So I want to talk about another quality that all my clients seem to share in common, and that is that that the two hemispheres of their brain don't communicate very well. And here's what happens. And the reason they don't communicate very well is because they didn't learn in childhood in their relationship with their primary caregivers, mom and or dad. They didn't learn these skills of emotional regulation. And so the two hemispheres don't learn to communicate well together. And then later in life, when in life it's full of challenges, there will always be challenges, but for the people who don't regulate emotions well and whose hemispheres don't communicate very well, here's what happens. On the right side tends to be more activated, and the left side, where we get our thoughts from, tends to be actually diminished in size. And so when a challenging event happens, for people with poor emotional regulation, the right side lights up. And so as it lights up, it shuts the left side down. So with people in recovery, for example, they learn all these wonderful lessons, 12-step lessons. They go to meetings. They learn lessons in the therapy session. And then something unfortunate happens there, and they get emotionally activated. The right side gets active. Maybe they feel intense shame or intense fear or intense anger, and that shuts the left side down, and they forget the lessons they learned in 12-step. They forget they're supposed to call their sponsor, they're supposed to go to a meeting, they're supposed to get on the phone list and talk to somebody, and instead they do what worked for them for always. They run off to the dope house. So emotion regulation is important, and getting the two hemispheres to communicate is important. And this tool that I use in the therapy session is this little device. It's called a TheraTapper, and it gives a gentle, you may be able to see the lights going, it gives a gentle vibration through these two probes. One is held in each hand, and they alternate. It's called tactile, that's for feeling or sensation of feeling, and alternating, because it goes back and forth, bilateral, one side to the other stimulation. I call it tabs. Now you can do this for yourself if you want, go just like this, alternating, or you can tap on your knees or your thighs if you want to. It will do the same thing. And so this is integrated into the skills. As people learn the skills to regulate the emotions I mentioned, fear, anger, yearning, sadness, and so forth, as they learn those skills and use the TheraTapper, one thing that we've learned in the decade of the brain of the 1990s is that the brain is incredibly plastic. And as clients do this work, the band of tissue that connects the two hemispheres develops better, and the hemispheres communicate better, and then the person is able to meet the world with a brain that is integrated. Some people call this whole brain, that is better integrated, and so that they can bring, because they can control emotion of fear, anger, and so forth, this side doesn't light up and suppress this side, so they have left brain help for regulating the right brain and its emotions. So one of the things that happens for many people, I'm going to talk just a little bit about what happens to the whole brain in people with depression or anxiety, and how this work can help. Clients may often make a negative comment, and these are for people who've already gone through the skill set that I'll mention in a different video. And so they're already able to notice what the feelings are that they're having, especially with a little help. And that's what therapists do. They provide a reparative or therapeutic attachment experience so the client can get the skills he or she didn't get in childhood.